Good afternoon. My name is Noel David. Can you say your name for the record, please?
Good afternoon, Noel. My name is Miley Crystal.
And what is your candidate number, please?
My candidate number is 23055248848.
Thank you. And you are taking this test as a nurse, is that correct?
Correct.
Thank you. Can I see your ID, please?
Sure.
The warm-up questions are not assessed as a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes. A patient is in severe pain, but the attending physician states nothing is wrong with the patient. What will you do in this situation?
As a nurse, we are taught that pain is subjective. If the patient perceives it, it does not mean it is not there. There was a reported similar case when a patient died due to extreme pain because the nurse disregarded his complaint. However, careful assessment is still required. I will perform the necessary pain assessment, using a pain scale rating to quantify the level of pain the patient is experiencing. I will correlate this to his or her chart and look thoroughly at his medical history to trace the source. Also, to safeguard the hospital against issues with dispensing controlled substances, I will also assess for depression, alcoholism, and possible substance abuse.
Describe a situation where you were able to perform under pressure.
We were doing our routine assessment in a respiratory ward when a patient with severe respiratory infection suddenly showed difficulty of breathing. I instantly rushed for the emergency crash cart while my colleagues called for the physician and performed CPR. I assisted with the intubation, keeping a close eye on the monitor. Unfortunately for me, another one had a respiratory arrest in the same room. It was a difficult situation, but we all managed to intubate and resuscitate both patients.
How much supervision do you need?
If I'm a new member of the institution, I would like to request supervision for 1 week. The first 2 to 3 days will be for close supervision, while the rest of the period will be for sensitive or critical care cases or on a must-need basis. After that, I can confidently work well on my own and will approach my superiors if I have problems.
Looking back, what trainings did you wish to have gotten from your previous position?
My previous position was demanding and the tasks were not easy. I was fortunate enough to have superiors who supervised with honing and improving my skill. However, I believe that oncology care for children requires better attention to assessment and patient communication. I would have loved to know more about how to assess these patients better, because they do not understand what they are experiencing and what they are going through.
You saw a team member making careless but minor mistakes, and he tells you to ignore it. The patient, however, is concerned. What is your course of action?
As a nurse, we are the patient's advocate above all else. I will talk again to my teammate and state that the patient is worried about the lack of attention to detail. If my team member continues with such an attitude, I have no choice but to report it to my immediate superior.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the first role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Good morning. My name is Miley Crystal. I am one of the registered nurses in this facility. For my confirmation, Can you give me your name, please?
Hi Miley, you can call me as Huckle.
Hello as Huckle, you seem to be quite upset. Is there anything bothering you?
I have consulted the doctor with some unusual tiredness, and he diagnosed me with post-traumatic epilepsy. I am really worried and unsure about my situation.
I can understand how you are feeling right now. Don't worry, I will explain what epilepsy is to you. Epilepsy is the disruption of electrical activities in the brain, whereas post-traumatic epilepsy is a form of acquired epilepsy that results from brain damage caused by physical trauma to the brain. For my better understanding of your condition, shall I ask you a few questions?
Sure, you may proceed.
Do you have a history of fall or accidental injury to your head?
Ah, yes. I had met with a road traffic accident 1 year before when I was overseas, and I suffered from a head injury.
All right, so the cause for your present condition is the head injury resulted from the road accident.
I wonder how a head injury can lead to a condition like this.
I realize your anxiety. Definitely, I will help you to sort it out. But before moving further, would it be okay if I can ask you some questions?
All right, go ahead.
Do you experience any sort of disturbance or physical illness after the accident?
Yes, I feel more lethargic and less alert than usual after the accident. That is the reason why I consulted the doctor.
All right, have you ever experienced headaches?
To be frank, a headache is a usual companion for me. Even before the accident, I was experiencing headaches at very frequent intervals. To be more clear, at least twice a week.
Okay, other than this, anything else you have been feeling since the accident?
After the incident, I had a history of recurrent blackouts nearly 5-6 times.
Mr. Huckle, unfortunately, these were some of the initial signs of your current disease.
Oh my God. I could have taken care of me a bit earlier.
Don't worry, Mr. Huckle, we are here to help you. This condition has a very definitive treatment plan.
Okay, so please tell me how long I need to continue these medications, and what are the side effects?
I am glad to explain it to you. The medications for epilepsy are usually continued until there have been no seizures for at least 4 years. And sometimes, it is necessary to continue the medications for a lifelong. The medications which are prescribed for you are the best possible solution for relieving your symptoms.
Could you please explain it to me?
Your symptoms such as headaches, blackouts, and tiredness can be safely controlled with these drugs, which are prescribed for you, and also, it will enable you to lead a normal life to an extent. However, the side effects as you suspect are really rare, and if you find any kind of side effects, kindly report them to the doctor. Definitely, the doctor will change the medication accordingly.
All right, but I have read that the medications, which are used to treat epilepsy, will restrict travel to some countries that I wish to travel in the future.
Okay, your concern is really understandable. But, don't worry, none of the medications prescribed to you will affect your travel. You will be able to travel to any country as you desire. The only thing you should consider is not to miss the medications while you are on a trip.
That's really nice. If possible, can you please provide me some more information regarding epilepsy?
Sure, there is an Epilepsy Foundation available. They can provide you more details regarding the disease and its management at home. If you are interested, I can provide you with their contact details, and I can also fix an appointment for you.
Yes, I'm really interested.
All right, I can give you their phone number and location details as well. In addition, I could also supply you with some of the literature that helps you to know more about post-traumatic epilepsy.
Okay, that will be grateful.
All right, Mr. Huckle, do you have any other concerns that I need to be answered?
Nope, not anything more for now.
Okay, I hope I have cleared all your doubts. If you have any other doubts, kindly don't hesitate to contact us. We are here to help you.
Thank you for your kind approach.
You are welcome. I wish you a very speedy recovery.
Thank you. That is the end of your speaking role play. Thank you.
Thank you, sir.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.